Over the last 10 years, the cost of employee-provided health plans has increased quite a bit. And with it, there's been a lot of changes to the plans offered to employees. And nowadays, one of the more common plans that are offered to employees is something called a high deductible plan. A plan where an employee has a very high deductible they have to meet before the insurance coverage will kick in to pay benefits. To offset the loss of benefits, the IRS created a health savings program called the HSA, Healthcare Savings Account. And what it does is it allows an employee with their family to set aside a little over $7,000 a year, tax deductible, to be used for covered healthcare costs. And the average person that has those accounts will set those up, they will fund them, and as the year goes along and they have to pay deductibles for the doctor or pay for prescriptions, they'll access the money that's in their HSA or healthcare savings account to pay for those expenses. And what it does is it allows you to pay for those costs with pre-tax dollars. So in other words, the government's really sharing in the cost. You took a deduction on your tax return, you paid less in taxes, you take that money out of the account, you don't have to pay taxes when you take it out if it's used for a qualified expense, qualified medical expense. But one of the additional benefits of the HSA is it doesn't have to be used in any current tax year. So if you put money in this year and you don't use it, you don't lose it, right? Some of the old plans, if you put money in a flex spending account, you didn't use the flex spending account, that if you didn't use it by a certain date, that money was gone and it was no longer available to you. But an HSA sticks around. So what we're starting to see is we're starting to see people utilize these more like a retirement account and an investment account. They take advantage of the tax deduction, they put that money in an HSA, and if they have a year where they don't have a lot of medical expenses, say they go to the doctor, they visit their doctor for a physical, their spouse visits the doctor for the physical, they don't spend a lot of money, they cover that money out of pocket, they start to build up balances in their HSA. And now we have the ability for our clients to be able to invest those HSA dollars, right? So that's a kind of an important feature for people that are able to put money in an HSA and don't need that money to cover current expenses. Because what you can do is you put that money in, you invest it just like you would an IRA. If you can leave that money for 10 years, 15 years before you have any covered expenses, that money can grow significantly. And one of the things retirees are learning, and one of the things we talk to retirees about quite a bit, is one of your biggest expenses in retirement is healthcare costs. Yes, you qualify for Medicaid, or Medicare, I'm sorry. Yes, you'll qualify for Medicare, but you'll have to buy a Medicare supplement program, which in a lot of instances, those programs can be covered with HSA money. But you'll also have a lot of out-of-pocket expenses for things like prescriptions and doctors. We go to the doctor more as we age. Healthcare costs, they say the average retiree can spend up to $250,000 in healthcare costs during their retirement. So if during your working years, you can set aside money in an HSA and you're younger, you're healthier, you're not going to the doctor as much, you don't necessarily need the money, you can invest that. And if that money can grow at 6, 7, 8, 9% for the course of over the course of 15 or 20 years, that money can go a long way to covering your healthcare costs when you're in your retirement years. Because remember, when that money comes out of an HSA, if it's used for medical costs, there's no tax on those dollars when you take that money out. If you didn't have an HSA and you have to cover Medicare supplemental plans when you're retired and you have to take money out of an IRA, that money is going to be subject to tax. An HSA can be a very effective tool for both a person that saves and puts that money in currently and needs it because you're using it for pre-tax dollars, but it's also a very effective tool for someone that can put that in, doesn't need it right away, can invest that money and have that money available to them during their retirement years to cover what will be a very significant part of their retirement expenses when they get there.